Preparation for RRB staff nurse. Here I discuss the previous year's questions and the answers in details. So the question is, a condition of inner ear characterized by the episodic vertigo, tinnitus and sensory neural hearing loss is referred as. The options are otitis media, nystagmus, Meniere's disease and otosclerosis. So the answer is Meniere's disease. It is an inner ear disorder that occurs due to the fluid changes in the middle ear, and this condition causes vertigo sensation of spinning. People with this disease are treated pharmacologically with symptomatic treatment. Mainly the surgery is not required for the disease. Here you see the two pictures. In case of the healthy inner ear, the endolymphatic sac, hearing and balance nerve, balance canal, hearing canal are normal. But in case of the Meniere's disease, backed up fluid leads to swelling and pressure. Distorted the information travel to brain, and also swelling distorted sound information and balance information. The next question is, growth hormone will be secreted by which of the following endocrine glands? The options are adrenal gland, pituitary gland, ovaries and testes. So the correct answer is pituitary gland. Growth hormone is also known as the somatotropin or human growth hormone, mainly secreted by the anterior lobe of the pituitary gland, and the cells that secretes the growth hormone, mainly known as somatotropes. The posterior pituitary gland secretes two hormones, oxytocin and ADH or vasopressin. Here you see the picture of pituitary gland and the anterior and the posterior lobe of the pituitary gland. The next question is, breakdown of glycogen to glucose is known as glycolysis, proteolysis, glycogenolysis, proteogenolysis. So the answer is glycogenolysis. It is a biochemical process in which the glycogen breaks down into glucose 1-phosphate and glucose. The site of this reaction is hepatocytes and myocyte cells. Mainly, the process occurs in cytoplasm of liver, muscle and adipose tissue. The next question is, which are the functional unit of kidneys? Nephrons, neurons, nerve cells, nerve fibers. So the correct answer is nephrons. The nephrons are functional unit present in the kidney, and there are about 1 lakh nephrons in each human kidney. It actually produces the urine and helps to produce urine and also to remove the waste products from the body. The kidneys receive the blood from the renal arteries left and right, which branch directly from the abdominal aorta. The main function of the kidney is filtration, reabsorption, secretion, excretion, hormone secretion and blood pressure regulation. Here you see the structure of nephron, and it is made up of renal corpuscle, proximal convoluted tubule, distal convoluted tubule, collected duct, and also the cortex medulla and loop of Henle, which is U-shaped. Next question is, inadequate pumping action of the heart is known as. The options are obstructive shock, septic shock, anaphylactic shock and the cardiogenic shock. So the correct answer is cardiogenic shock. It is the condition in which the heart is unable to pump the adequate blood to the systemic circulation, and it is known as cardiogenic shock, mainly occurs due to the heart failure. The signs and symptoms included the pallor, cold and clammy skin, tachycardia, nausea and vomiting, pupil dilation, weakness or fatigue. The complications occurs in cardiogenic shock is cardiopulmonary arrest, dysrhythmia and renal failure, and also stroke, and may cause death of the patient.